Are very vague. You may not find any symptoms till your diabetes crossed a very high level. But the most common and most frequently observed symptoms are thirst. The first thing what you're going to suffer is you'll feel thirsty. Even after having liters of water, you'll still feel thirsty. Second is increase in appetite. You will feel that you are hungry most of the time, and even after having food, you'll feel hungry again. Third is weight loss. Now, some people say, Doctor, I'm eating so much food, still I'm losing so much weight. That's the reason you should check your sugars, because that's one of the very common symptom is weight loss. Other symptoms are very vague. Some people feel a lot of tiredness, fatigue, they feel dizzy, they feel exhausted. Even after working a little bit, they feel exhausted. That's of course one of the very common symptoms. The other question is, what are the types of diabetes? One of our patients says, Doctors, I'm just 30-year-old. Do you think I have diabetes? The answer is yes, you can have diabetes. The diabetes basically are two types. One is type 1 and type 2. Type 1 diabetes is mostly seen in young patients. It can also have in children. And type 2 can be happening in as early as when you are 20 years of age. Now, what is the difference between type 1 and type 2? Type 1 diabetes basically means that you absolutely lack insulin, and that's the reason we have to give you insulin injections from outside. And there are various types of insulin which I'm discussing in further lectures. Type 2 diabetes means that you still have a reserve insulin in your body, and we can manage by diet, exercise and drugs. Now, who are at risk of developing diabetes? That's the most, again, a very common question I've encountered in my practice. Now, diabetes can happen to anybody. There is no particular rule as such. But studies shows there are certain set of people which are affected more than the others. The first one is family history. For example, if your mother or your father has diabetes, or your siblings, your brother or your sister has diabetes, you are more prone for having a diabetes problem. Second is if you have high blood pressures, if you have high cholesterol, such set of patients also have been noticed to have diabetes. If you're obese, you are overweight, you don't do proper physical activity, then you may land up in diabetes, which is a type 2 diabetes. If you are pregnant, you may get diabetes during your pregnancy. You'll also notice that during pregnancy, your doctor may advise you to do sugar level at certain intervals, because we have seen that women who are pregnant, who are prone to get more diabetes if they have more family history of diabetes. So these are set of patients I would like to say are more prone for diabetes, but it does not stick to this. It can happen to anybody at any time. Other question is, Doctor, how will I diagnose my diabetes? How can it be found out that I have diabetes? Now, today there are various tests available in today's, and there are so many diagnostic centers and hospitals come up with this. For diagnosing diabetes, it is very simple. First test is a fasting blood sugar. This means that you require at least 8 to 10 hours of fasting. And in the morning, without having anything, you need to give your blood. And if that sugar is at a level more than the recommended, that means you have diabetes. The other test is after 2 hours of eating food. If that crosses more than 200, then you may have diabetes. The more precise test which has come up right now is known as HbA1c. If you have this beyond the cutoff value, it's a very sensitive test. So this basically shows your sugar in the past 3 months. And if you cross that sector, you definitely have diabetes. Other question is, Doctor, is diabetes preventable? It's a very important question. Well, type 1 diabetes is very difficult to predict. So if a person who has type 1 diabetes, you cannot avoid it. It cannot be treated. It can only be treated by insulin. It cannot be reversed. But type 2 diabetes is very much treatable. Some factors, if you keep in mind, you can avoid type 2 diabetes. One is regular physical activity. Second is having a very healthy life. Third, controlling your blood pressure, controlling your cholesterol. Fourth, avoidance of alcohol and tobacco. These criteria, if you follow, I'm very much sure you can control your type 2 diabetes. The last and most foremost question is, doctor, how can my diabetes affect my body? What are the complications of diabetes? Well, diabetes technically affects every part of the body, but the most common is, I start with your eye. So diabetes can lead you to blindness. It can lead you to diabetic retinopathy, in which you can lose your eye. It can affect your kidneys. It can spoil your kidneys, and you may lose up your kidney in long-term diabetes. It can affect your heart. It can affect your brain. It can affect your leg also. A lot of diabetic patients who have not controlled the diabetes develop gangrene of the leg. They develop ulcers, and which may lead to amputation. Amputation means you may lose your leg. That's the reason diabetes is such a dangerous disease. But the good news is we can definitely control diabetes. It's a very much treatable disease. So my friends, I request you all to please lead a healthy life. If you have diabetes, please try to take regular medications. Go to your doctor. If you want to find out, I would always suggest husband and wife, everybody in the family should go for regular health checkups so that we can diagnose diabetes very early and treat them accordingly. Together we can definitely lead a healthy and prosperous life. Thank you very much.